what can you do with these things? And we already saw a few things. You can put in a whole bunch of implants, go straight through the soft tissue, don't really care about the attached tissue, place a CAD/CAM generated abutments on there, immediate load that, and later on change that into porcelain fused to metal. Or you can again place a whole bunch of implants, again pre-make custom abutments. Now do it a little bit different and first place reference implants. I can now retrofit my guide and my denture, and now I can flap, place the guide back, place the implants. I have now the opportunity to place some connective tissue. I love this stuff in mucograft, the connective tissue out of a little carton on the side. Put the abutments on, do the immediate load. 6 weeks later, that looks pretty good. Put porcelain on, and we see our finished case. Or you can place 5 implants. Do the planning as we have it there, place the implants, and do an acrylic temporary prosthesis. Then later on, change that into a fixed hybrid. Or you can place 4 implants and immediately place the permanent prosthesis on there. We don't have time to talk about it, but if you go to YouTube and you do a Stumpel DDS, you see that I put some videos on there where I'm doing this. So in this case, we have done the planning, and we're now making the definitive prosthesis before we place the implants. This is the metal framework, the teeth around it, everything set up, implants being placed, implants placed, abutments placed. I have to adjust the soft tissue a little bit. You can use an electrosurge as long as you put like a little plastic cap on it, otherwise you will be obviously getting sparks going around. And now I'm using the CAL technique, a technique that I've been using for 20 years. It's not mine. I have a metal framework and little cylinders that I can glue in. There is some space, so it allows me to adjust the space a little bit. Panavia, glue it in there, and we have our final prosthesis. So this patient came in with a removable prosthesis, and she left with 4 implants and the definitive prosthesis. So not a temporary, but a definitive prosthesis. And there she is. You can place 3 implants. And then 3 implants, and this is the smart fusion from Nobel. This guy obviously had to lose his teeth and got his implants in there. You can place 1 implant. You can place 1 implant, and this is how we did it in the past, where you had a scan appliance, or as we do it more nowadays, where you can actually fuse the intraoral scan or the scan of the cast together, and then you can make something like this.